Hey, so I saw Miss Tanaka. She's our 32-year-old female. She came to the ER with some nausea, vomiting, and right lower quadrant abdominal pain that she's had for about the last 24 hours. The nausea, vomiting started first, and then she had the abdominal pain later, and it's worse when she moves. She doesn't have any fever, chills, or any recent sick contacts. For past medical history, she had PID last year, but that presented with left lower quadrant abdominal pain. She has no other medical problems. She's allergic to penicillin, and she doesn't take any medications.
Okay.
On physical exam, her abdomen is soft, but she does have some tenderness to palpation in the right lower quadrant with some guarding, but she doesn't have any distension. Her heart and lung exam is normal. For her labs, her white blood cell count is 13, her hemoglobin is 12, platelets 165, her creatinine is 0.9, and her INR is 1, and a CT scan is pending.
Okay, great. What things are you considering on your differential?
Well, I think appendicitis is probably the most likely given her nausea, vomiting, and pain, but then also she had PID last year, so that would be the next on my list.
Is there anything else on your differential that you'd like to consider given the patient's age and gender?
Well, I did forget to ask her about her last menstrual cycle, and I think that would be important before we took her to the OR. So we can order a pregnancy test too.
Okay. Does that inform you anything in terms of your differential and the exams you may need to perform?
I guess tubal ovarian abscess is on the differential, but I didn't think a pelvic exam was necessary since we're getting a CT anyway.
We should also consider ectopic pregnancy in a patient within this age group and obtain a sexual history as well. All patients suspected of appendicitis need a rectal exam to assess for tenderness as well as signs of IBD, which should be on your differential. And all sexually active female patients need a pelvic exam even if they get a CT. Are there any specific signs on exam that might help you determine if it's appendicitis versus PID versus any other causes of right lower quadrant pain?
Well, I guess I could have done a psoas or Rossing sign, but I haven't done those yet.
Okay, well we can do those together. Are there any qualitative ways to determine how suspicious you are for appendicitis in order to order a CT?
I'm not really sure, but that sounds great.
Okay, let's look up the Alvarado scoring system for appendicitis, and tomorrow let's talk through when it can be helpful and what the limitations are.
Okay.